Hello, good evening, all of you. Welcome to my channel. Myself, Sudipta Muhakul, Department of Physical Education and Sports Science. Today, I am discuss about very interesting and important topic. This is first aid. So let's start. After the injury or illness, it is used for the treatment or care. So, first aid. First for first, I for investigation, R for relief, S for symptoms, T for treatment, A for arrangement, and I for immediately, D for disposal. What is first aid? First aid is the immediate care provided to an injured or ill person before the professional medical help is available. It is focused the preserving life, preventing harm, and promoting recovery and medical professional arrive. It is why it is used. It is used for life saving, reduce the injury and recovery, and build a confidence. Many key aspect is there. This is immediate care, preserving life, preventing harm, promoting recovery, basic skill, and non-expert expert care. Shock is a dangerous condition where the body is not getting enough blood flow. Symptoms of shock: cold or clammy skin, fast or weak pulse, rapid breathing, vomiting, confusion or anxiety, and bluish lip or fingertips. First aid for shock. First, call emergency service immediately. Next, lay the person down on their back if possible. Next, keep the person warm or comfortable. Then, do not give them anything to eat or drink. Then treat any obvious injury, and last, monitoring their breathing and consciousness. Poison. Poison is a substance that can harm or kill living organism. First aid for poison. First, call the poison helpline immediately. Next, follow the instruction given by the poison control center. Then, the person has stopped breathing. Then, use CPR. If poison is on the skin. Next, poison is in the eyes. Wash the eyes with cool and warm water 15 to 20 minutes. Next, the person inhale poison, then them to get fresh air immediately. Next, do not induce vomiting unless instructed to do so by a medical professional. Next, save any vomiting materials for the medical team to analyze. Burn is an injury to skin or other tissues caused by electricity, cool, heat, chemical, friction, etc. Burn, stop burning process. Now remove the person from the source of the burn. For electrical burns, ensure the power is off before approaching. Chemical burns, wear gloves, remove contact clothing, and then flush the skin with water. For minor burns, cool the burn and remove tight items. Then protect the burn, then relieve pain, and last of all watch for infection. Then minor burns. First, call emergency service immediately. Do not remove burned clothing. Cover the area. Elevate burn area and possible to reduce swelling, and do not in was the water. What to avoid? Do not use ice or cold water on burns. Do not break blister. Do not apply butter and greasy substance. So this is the pictures for minor and major burns. You've used the first aid. Next, drowning is a condition where a person has difficulty breathing or stop breathing because water or another liquid fills the lungs. First aid for drowning. First, ensure the own safety first before attempting a rescue. Next, remove the person from the water as quickly and safely as possible. Next, call for emergency medical help immediately. Then check for responsiveness and breathing. First, respond the breathing, monitoring them closely for any respiratory distress and keep them warm. Then unresponse or breathing. Place them in the recovery position and monitor breathing until help arrives. Then, if the person is unresponsive and not breathing or not breathing normally, gasping, being used CPR immediately. CPR, that's mean cardiopulmonary resuscitation. Place the person on a firm, flat surface. Then be prepared for vomiting, as the person may have swallowed water. Turn them on their side to prevent aspiration. Then treat for hypothermia by covering them with warm, dry clothing and blanket. Next, bleeding. Bleeding is the loss of blood from the body due to a injury. It can be internal or external. First aid for bleeding. First, protect yourself from blood pathogens by wearing gloves if available. Next, apply direct pressure. Then maintain firm and continuous pressure. Then, if the bleeding is severe and from a limb, direct pressure does not stop it is to tourniquet may be necessary. Next, elevate the injury body part above the level of the heart is possible to help reduce bleeding. Once bleeding is controlled, secure the dressing firmly with a bandage. Next, watch for shock. Next, seek medical attention if the bleeding is severe. Then, to do not remove any embedded object, apply pressure around the object. Next, treat any visible burns. Then next and last, be prepared for shock. Common injury. Common injury is various type, but now I discuss about 5 common injury. First is fracture. Fracture Fracture is a broken bone result from trauma or over pressure. Next, dislocation. Dislocation happens when a bone is forced out of its joint, leading to painful swelling and weakness. Then, head injury. Mild and reversible brain injury from a blow to the head, potential causing loss and consciousness. Fourth, sprain. Sprain is a ligament injury. It is the bend of fibers tissues that connected bones to other bones, and sprain are often caused by twisting and overstretching a joint. Common sprain include ankles, knees and wrist. And strain is a muscle or tendon injury. The fibers cord the tissue that connected muscle or to bone. Strain are often caused by overstretching and tearing these tissues. Common site for the strain includes the back, hamstring and calf. So sprain is a ligament injury. It is to bone to other bone, and strain is a muscle or tendon injury. It is muscle to bone joint. So who is the common injury? The use of which first aid treatment? This time use RISE method. This is a general and guideline for many common sports injury like sprain and strain. R for rest, I for eyes, C for comprehension and E for elevation. Rest. Rest. Avoid using the injured area. Injured area is provided sometime rest. I. Apply the ice packs in a clothes for 15 to 20 minutes at a time, and every 2 to 3 hours, and first 24 to 48 hours to reduce swelling and pain. Comprehension. Work the injury area with a use tight bandage and help reduce swelling. Elevation. Keep the injury area raised above the level of heart and help reduce swelling. So this is the strain and this is the sprain, and this is the dislocation of the shoulder, and this is the bone fractures. Various type of bone fracture is showing the picture. This is the link. So thank you all of you.